The legal aspects of nursing practice in the Philippines focus on the specific laws that shape our responsibilities, protect our rights, and guide how we deliver care. These laws are not just rules. They are safeguards that help us provide ethical, professional, and safe nursing services. Understanding these laws allow us to better advocate for ourselves and most importantly for our patients. The Philippine Nursing Act of 2002 or the Republic Act 9173 is the foundation of our profession. It provides the structure and standards for nursing education, licensure, and practice in the country. It also outlines the responsibilities of the Board of Nursing, which regulates our profession. One key provision is the requirement for all nurses to pass the nurse licensure examination. This ensures that everyone practicing nursing in the country has met the minimum competency standards necessary to provide safe and effective care. The Act also defines the scope of nursing practice, emphasizing roles in health promotion, disease prevention, curative care, and rehabilitation. For instance, nurses are empowered to work independently in health education or collaboratively in multidisciplinary teams. Imagine a nurse handling a barangay health program. They assess community needs, develop strategies to address health issues, and provide education on disease prevention. All these actions align with the scope of practice defined in Republic Act 9173. The Universal Health Care Act or Republic Act 11223 is designed to make quality health care accessible to all Filipinos. For nurses, this means taking on expanded roles in public health and community-based care. Nurses are now key players in managing health programs that focus on preventive care and education, especially in underserved areas. This law also supports additional training for nurses to enhance their skills in delivering primary care. Think about a public health nurse who organizes a vaccination drive in a rural barangay. This role includes educating families, ensuring vaccines are stored properly, and addressing concerns about side effects. Under the universal health care, these efforts contribute to improving community health outcomes. The Data Privacy Act protects sensitive personal information, and as nurses, we are at the forefront of handling such data. This law ensures that patient records are kept confidential and used only for their intended purpose. For example, when you document patient care during clinical rotations, you must ensure that records are secure and shared only with authorized personnel. This includes avoiding discussions about patient details in public places or on social media. There was a case where a nurse shared a patient's condition in a group chat, and the patient's family discovered the breach. The nurse faced penalties under this law. This emphasizes the need for us to maintain confidentiality at all times. The Anti-Violence Against Women and Children Act, or the Republic Act 9262, requires nurses to act as mandated reporters when they suspect abuse or violence. This law ensures that vulnerable individuals like children and women receive protection and intervention at the earliest signs of harm. In practice, this means nurses must document and report any physical, emotional, or behavioral signs of abuse they encounter during patient care. Accurate and timely reporting can save lives and prevent further harm. A nurse working in an emergency room noticed bruises on a child admitted for fever. After asking careful questions, the nurse reported the case to her superior. It was later confirmed as a case of domestic violence. That nurse's action likely changed the course of that child's life. The Occupational Safety and Health Standard Act, or Republic Act 11058, focuses on ensuring safe working conditions for all employees, including nurses. This is especially important in our profession, where exposure to hazardous materials and infectious disease agents is common. The law mandates the provision of personal protective equipment, or PPE, proper training on workplace safety, and implementation of measures to reduce occupational risks. For example, ergonomic measures might be implemented to prevent back injuries among nurses frequently lifting patients. During the COVID-19 pandemic, a hospital in Metro Manila faced penalties for failing to supply N95 masks to its staff. Nurses are on the front lines and must have proper protection, and this law ensures accountability in such situations. This law on patients' rights and obligations, or the Republic Act 8344, protects the patient's rights, particularly their right to informed consent. It ensures that patients fully understand their diagnosis, treatment options, and potential risks before agreeing to any procedure or care plan. For nurses, this means not only witnessing consent forms, but also ensuring that patients have genuinely understood the information given by the healthcare provider. It's about advocacy, making sure no patient feels pressured or coerced. A patient diagnosed with cancer might hesitate to undergo surgery. By explaining alternative treatments, risks, and benefits, a nurse can help the patient make an informed decision that aligns with their values. The Comprehensive Dangerous Drugs Act of 2002, or Republic Act 9165, regulates the handling, storage, and documentation of controlled substances like opioids. Nurses play a critical role in ensuring these substances are used appropriately and safely. Proper documentation and secure storage prevent misuse, diversion, and legal issues. Any discrepancies in drug records must be reported immediately to prevent further complication. In one case, a nurse faced legal action for failing to document the administration of a narcotic. Such incidents highlight the importance of meticulous record keeping to comply with this law. Advanced directives, supported by the Civil Code of the Philippines, allow patients to express their preferences for end-of-life care, such as do not resuscitate or DNR orders. Nurses play a key role in advocating for these decisions, ensuring they are respected and implemented correctly. Clear documentation of the patient's wishes is critical in preventing conflicts during care. A nurse working with a terminally ill patient helped the family understand the implications of a DNR order. The patient passed peacefully with their wishes fully honored. The Safe Spaces Act, or Republic Act 11313, protects individuals, including nurses, from harassment in the workplace. This includes verbal, physical, and sexual harassment. For nurses, this law ensures a safe and respectful working environment, allowing us to focus on providing quality care without fear or intimidation. A nurse reported a colleague for making inappropriate comments during a shift. The hospital took immediate action, demonstrating the effectiveness of this law in maintaining workplace safety. Delegation is an essential skill for nurses, as outlined in the Philippine Nursing Act of 2002, or RA 9173. It allows nurses to assign specific tasks to qualified personnel while retaining accountability for the patient's care and safety. A nurse might delegate vital sign monitoring to a nursing aide, but must still review and interpret the results to inform patient care decision. The Continuing Professional Development, or CPD Act of 2016, or Republic Act 10912, ensures that nurses continue to grow professionally by requiring them to earn CPD units for license renewal. These units can be earned through training, workshops, or seminars that enhance skills and knowledge. A nurse attends a seminar on wound care management to fulfill CPD requirements, and that nurse will also show an improved ability to manage complex cases in the hospital where she is working. Understanding the legal aspects of nursing practice in the Philippines is very important. It will enable us to protect ourselves, advocate for our patients, and deliver the highest standard of care. Each law that we have discussed plays a vital role in ensuring that our profession remains ethical, accountable, and safe for everyone involved. As future nurses, it's crucial to embrace these legal principles and apply them in your daily practice. Remember, knowing your rights and responsibility not only empowers you, but also strengthens the trust patients place in our profession.